Well, there is one healthy habit that you don't want to kick, and that's anything that's going to keep your ticker ticking. That's because heart disease is the #1 killer of both men and women.
Particularly women. In fact, studies show heart disease kills 1 in 4 women.
Yeah. The question is, how's your heart health? Well, that's the problem that a lot of people they don't know. But there is a free way that you can find out, and joining us today to tell us about it is exercise physiologist Caroline Farrell, almost got it wrong, with the Peninsula Regional Medical Center. Thank you so much for joining us today. Now, we have talked a bunch on Delmarva Life about heart disease. It impacts a lot of people.
It truly does. We work in cardiac rehab. We see patients every day that come from all different kinds of lifestyles, backgrounds, different health complications, and all of them are touched by heart disease. And it's very scary to see how many people it really does touch.
What is heart disease?
There's several different complications that are considered heart disease, but all of them either affect the function of your heart, how well it can either pump blood or receive blood, and then how well it distributes that throughout your body, whether it's blockages that are preventing that. That's one of the versions of heart disease. Also just complications with the shape of your heart and how it's able to function due to those changes.
So are there signs we can look for heart disease?
There are a lot of signs. They do say it is a silent killer, but there are a lot of things that we can pay attention to if we're aware. Something just as simple as excessive shortness of breath, excessive fatigue are some ones that maybe people don't typically associate with heart disease. We typically think of the chest pain, arm pain, jaw pain. Those are the ones that stand out to us a lot, but it really can be something, like I said, shortness of breath, excessive sweating, and then of course knowing your numbers. If you have high cholesterol, high blood pressure, all of those can play into heart disease as well.
Now, here's the thing. I think a lot of people associate heart problems with people who are out of shape or especially overweight. You know, someone who, you always see it when someone has a heart attack who runs 5 miles every day or really eats well and everything. People are like, well, see, you know, it's not necessarily just lifestyle.
It's not at all, and actually people tend to think that you only have high blood pressure or high cholesterol if you are overweight, and it is a misconception because we focus so much on weight loss or being obese and how much of a risk factor it is for heart disease, but it's only one of the many risk factors for heart disease. I think we do focus on it a lot, and it is very important, but yes, someone who is very active with their lifestyle, eats well, they are going to still have, if they have those family conditions, family history that are going to make them more prone to have things like high blood pressure, high cholesterol. Unfortunately, kind of the family history is going to take over, whether you're overweight or not, whether you're exercising or not. But that's why it's important to make those healthy choices, especially with the family history.
So then you'd say those who are most at risk are?
Those that are most at risk, I would definitely say someone who has a severe family history, someone who smokes. Obviously, if you're a smoker and you have family history, unfortunately you're almost doomed to get some type of heart disease. And then obviously the sedentary lifestyle. But just because you exercise doesn't necessarily mean that you're going to avoid it, but you're at least putting yourself ahead of the game and being a little bit healthier, making those choices.
And that's why it is important to know your numbers no matter where you are.
Yes, absolutely.
In that situation. And PRMC has women's screening.
Yes, we do free women's heart screenings. We do them year-round. They're on Tuesday and Thursday mornings. They're actually an hour-long appointment. They're a pretty comprehensive exam. We look at all the risk factors related to heart disease. You'll even get an EKG, a peripheral artery disease screening. We screen for osteoporosis, and then of course cholesterol, your HDLs, your body fat percentages, body mass indexes, height, weight, all of the general things that kind of play into those risk factors for heart disease.
Are there any requirements to participate in the?
We don't want you to already be seeing a cardiologist. We wouldn't want to interfere with the care that you're already getting. Okay. So if you are seeing a cardiologist, that would make you ineligible. But other than being 18 and older and female, there are no other contraindications to being eligible for the exam.
And everyone should do this. There's no reason to be ashamed to do this.
Absolutely. And I get plenty of completely healthy women that come in there, but they like to come in. It's great to kind of target that younger age group. We so often hear, oh, this is something that's going to affect women of older ages. 55 and older is kind of a number we throw out there a lot. at the very least, even if your exam is wonderful, it is awesome to get these baseline numbers so that we know what we're working with, because as we get older, some of these numbers tend to change, and it's good to kind of know where we started so we can look at the progression and the changes for those numbers. It's very important.
Yeah. Okay.
All right. So give us the when and where.
The when and where. Every Tuesday, Thursday morning at Peninsula Regional Medical Center, we do 4 exams, 8, 9, 10, and 11 a.m. And like I said, they're year-round, so you don't have to worry about getting in right away. If it doesn't fit into your schedule, we'll be there whenever you're ready. And you can make an appointment by calling 410-543-7026 and ask for a free women's heart screening.
All right. Now, Caroline, the screenings are for women, but heart disease affects men as well. So you're going to stay with us for a few moments. Up next on Delmarva Life, we're bringing in Sean, and we're putting his health to the test, literally.
We're going to see where his numbers stand, and Caroline's going to show us a few exercises that can improve your numbers as well if they're not exactly where they need to be.